Well, I grew up in Mississippi all of my life, and I went to college at Mississippi State and then went on to medical school at the university here in Jackson and completed medical school as well as internship and residency and then finally fellowship there. So I've been in Mississippi forever. So when I first thought I might want to do medicine as a career, I decided I would volunteer in some different areas in ERs and those kind of things. And I worked, one of those opportunities was working with a surgeon back home in Meridian when I grew up. And one of the experiences I had there was working in surgery with him, and I got to see some cardiac surgery, and I always thought it was just fascinating and kind of piqued my interest. And then through training, different exposure to different specialties, it just always seemed to be the one that stayed on the forefront as the most appealing, so that's where I ended up. And this, I think, kind of hopefully is the beginning of most people's career, but my philosophy was really just to treat the patients like it was my own family, how I'd want to be treated if I was in a similar situation. And I think that carries you a lot further than just having to see another patient, another check in the box, just see a patient and really treat them like you would want your mom to be treated. Cardiology in my area, there's kind of a little different than most other specialties, I guess, because there's some subspecialties of that. And so there's interventional cardiology where we treat the stents and the heart casts, and there's electrophysiology to do pacemakers, and all those are interesting to me, but I've really felt that general cardiology was probably my favorite part of it, just to take care of the general. You never know what's going to exactly be there cardiac-wise, and everything's a little different, so day to day, there's not the same thing every day, a little more variety, and so I really enjoyed that part of it. Just going through my career and questioning why you do things that you do, and just on a personal level too, I think I really have to decide why I do all the things that I do, be it at work or at home or hobbies or anything. And I really come to the realization that for me, my faith is a big part of that for me. And so to me, everything I have to do should be geared to what purpose I'm here for. And I really believe that more than just a job, this is my purpose. I feel that God has kind of called me to be a physician and to be a cardiologist and to be in Jackson doing that. And so more than just coming to work every day, I feel like I'm actually doing what He wants me to do. And if I'm doing that, I need to be doing it to the best I can. And so that takes some of the pressure off to know that I'm not just trying to finish another day's work, but I'm actually doing what God would have me to do. And I think that is, important in how patients see what we do. And we're not just another person, we're just, somebody that's there doing something on a bigger scale. And so I hope that's what I'm doing, because I think that ultimately I'm going to be responsible to Him for that, for how I've done my job here.